Ovary basically is endocrine organ for females. The most important function is to form oocytes, which are important for pregnancy. And the second important thing, it also secretes some hormone called estrogen and progesterone, and it is important for menses, the regulation of menses. The other most important factor is estrogen hormone and progesterone hormone. So they are safeguard for cardiac point of view. So they prevent heart attacks. So that they improve bone health. So ovary is important not only for reproductive system, it is also important for preserving your bone mineralization and also for your proper heart function to decrease the heart attack incidence. Ovarian cancer is basically a cancer developing in ovarian cells or fallopian tubes. So fallopian tube and ovary are they are just next to each other, and any tumor developing in that area is called tubo-ovarian mass. It's called ovarian cancer. So when tumor develops, fortunately, 80% of tumors are non-cancerous in ovary. If any female have this ovarian cyst or lump, she should not get afraid immediately. But it's important to consult doctor because many will be benign. So treating at right time that benign things, we can prevent ovarian cancer also. Ovarian cancer is mainly caused because of hormonal things. Estrogen and progesterone, they are two important hormones. Estrogen is slightly risky hormone and progesterone is safeguard hormone. So then their balance is lost. These patients develop ovarian cancer. The most important is if the female is could not become pregnant. If she became pregnant after 35 years of age, it increases the ovarian cancer risk. If there is no children, if she could not do breastfeeding, it has increased incidences of ovarian cancer. And smoking predisposes to ovarian cancer. Obesity is risk factor for ovarian cancer. There are certain females which carry genetic risk in the form of BRCA. BR means breast, CA is cancer. So BRCA mutation is present. There are two types of mutation, BRCA1 and 2. If this mutation are present, these females are more likely to develop into ovarian cancers. So genetic factor is there, the hormonal factor is there, and if some females are taking prolonged duration of oral contraceptive pills for more than 5 years, there it becomes a risk factor for developing ovarian cancer. Basically, there is ample space in your tummy to for the tumor to grow. So they have and ovary is situated in between the uterus and in between the urinary bladder and rectum. So they have very vague symptoms initially, just like bloating in the abdomen, the fullness in the abdomen, gas in the tummy. So they are the most common symptoms. It is said that ovarian cancer whispers. The symptoms are not very clear cut. So any bloating, any gas trouble for more than 3 weeks, it should be taken very seriously. Some patients they develop because of pressure on the urinary bladder, they develop frequency of micturition. Some patients develop constipation because of pressure on the rectum. So these are the most common symptoms which we get in ovarian cancer. After the cancer size increases, it causes fluid in the abdomen called ascites. So your tummy size increases, it becomes one of the most common symptoms for ovarian cancer. And very rarely, once it's spread to lung or other or pleural, there will be fluid in the lung cavity. So they develop breathlessness, jaundice, bone pains, backache. So these are the most common symptoms which we see for ovarian cancer. And very rarely, some tumors of ovary they secrete estrogen very high, so they develop again the bleeding increase in menses, menorrhagia, or it's called increase in menstrual bleeding or intermenstrual bleeding. That also becomes one of the sign of ovarian cancer. If any female who have this persistent gas trouble, persistent bloating, they should do at least a sonography of abdomen. Sonography can be a very good tool to identify if any ovarian tumor is present or not. If sonography is normal, rest assured, find out other causes. But if sonography is showing some tumor in the form of cyst or other things, then we do a test called CA125. It's a tumor marker to identify whether the ovary cancer secretary ovary cancer risk is there or not. And second, we do CT scan or PET scan to identify the stage of the tumor. If ascites is present, ascites means fluid in the abdomen is present, then we do ascitic fluid. We remove the ascitic fluid by syringe under sonography guidance, and we send it for examination called cytology for malignant cells to identify whether cancerous cells are present in there or not. So these are the rough tests. Generally, in early ovarian tumors, which is localized to ovary, we don't do biopsy because most of the time these tumors are partly cystic. They are partly containing fluid, and if we try to remove that fluid, the cyst will burst and it will spread the cancer cells in your tummy cavity. So it will increase uptake your disease. That's why biopsy is not preferable in ovarian cancer. When we have signs, we have other symptoms like CT scan findings, which suggest that ovary cancer risk is high, then we completely remove the ovarian tumor and we examine in the operation theater itself by the special test called frozen section, where we confirm the cancer is present or not. If cancer is present, we can do the complete surgery at the same setting. So these are the main important tests which are done to identify ovarian cancer. Ovarian cancer, generally the treatment depends on stage of the disease. So once the staging for a simple thing, if tumor is restricted to ovary, it is stage one. It is coming out of ovary but restricted to pelvis, means to the near the bladder, uterus, or the pelvic peritoneum. It is called stage two. Once it is coming from pelvis, coming to the abdomen cavity, it's called stage three. And if it is involving either liver or lung or bone, it becomes stage four. So treatment depends upon this stage one, two, three. The treatment will be decided. The treatment is surgery. For stage 1A disease, treatment is surgery, where we remove ovary, we examine via stage called frozen section. If cancer is confirmed, we remove the uterus, other ovaries. There is a layer of peritoneum inside the abdominal cavity, and there is a layer of fat called omentum. So these four things are removed, and any disease anywhere which is to be removed for a proper staging. If tumor is restricted to ovary, till we remove the parietal peritoneum and diaphragmatic peritoneum to identify exact stage. So stage one disease, stage two disease, surgery is main treatment. For stage three disease, where there is ascites is present, where the tumor is present in the upper abdominal cavity also, we have to assess by two things. One by CT scan to identify if we can remove all the tumor completely. In up to stage three, we can remove the tumor along with all the deposits in the abdominal cavity, diaphragmatic area. So total parietal peritoneectomy, where total peritoneum is removed, which is involved by the tumor, and along with uterus, ovary, omentum layer, and sometimes appendix and gallbladder also need to be removed if there are deposits over there. So this it becomes a complete cytoreduction surgery, which is advisable in fit patients which have stage 2, stage 3 disease. And stage 4 disease, we give chemotherapy. It is a palliative treatment. Our main aim is to prevent complications and improve patients' quality of life other than a complete cure. So for proper treatment, identifying them also becomes a very important thing. So surgery is a game changer in ovarian cancer. If you can do upfront surgery, it is always better. There are various patients with their various papers. We suggest that primary cytoreduction means upfront cytoreduction, and then chemotherapy has better outcomes. But patient should be fit, and if patient is unfit, then either first chemotherapy and then surgery becomes a gold standard. Ovarian cancer cannot be prevented, but there are certain risk factor in female where we can do some therapies. One is I told you that BRCA mutation patients. They are genetic patients. They have genetic tendency to develop ovarian cancer. So in those patients, prophylactic oophorectomy means removing ovaries after the childbirth is done after 30-35 years is ideal situation, because we are removing ovaries. These patients will not develop ovarian cancer. There are certain things which can decrease the risk of developing ovarian cancer, like taking estrogen plus progesterone oral contraceptives for up to 5 years. If you are taking more, or if you are taking estrogen only contraceptive pills, it increases risk. But if you are taking combination of estrogen progesterone, it decreases risk of having ovarian cancer. The third is you can tubal ligation has shown to decrease the risk of having ovarian cancer. First child before 35 years of age, proper breastfeeding, they are crucial factor. They are shown to decrease risk of having ovarian cancer. So you can concentrate on this thing also, and doing a regular sonography at least once in a year, where you can identify any cyst or any tumor developing in ovary is also a crucial factor. So these things, they can help in identifying tumor early. They can help in preventing tumor in susceptible population where the chances of ovarian cancer are very very high. Like I told you, like genetic mutation patients. So they are almost 50-60% they develop ovarian cancer. So in them, removing ovaries prophylaxically becomes important.